Are all of y'all ready? Imagine sitting in an emergency room with your son. He's clutching his stomach because he's in so much pain and he's so scared. You try to calm him down, but it's hard to because you have no idea what's going on. Good parents in this situation would do anything for their son, but they can only do so much. The mother of Nicholas Volker, Emilien Santiago Volker, has gone through this nightmare many times. Ever since Nicholas was a toddler, the doctors say that he has always had an inflamed intestine. Because of this, he has undergone 100 surgeries and has part of his colon removed. The doctors could never figure out what exactly he had, but they knew one thing. He was getting sicker and could soon pass away. Emilien knew that she would do anything for her son, so when the doctors told her that they might have a way of saving him, she easily complied. Howard Jacob is a geneticist at the Medical College of Wisconsin that sequenced Nicholas's genome. Doing this allowed the doctors to figure out what exactly Nicholas had so that they could create a successful treatment. Nicholas underwent a bone marrow transplant that inevitably saved his life, performed by David Margolis. The doctors in this situation like to say that sequencing Nicholas's genome saved his life. We have the Human Genome Project to thank for that. To understand why genome sequencing is such a huge milestone in science today, I would like you to consider why the Human Genome Project was created. Many years ago, people understood that children inherited their parents' traits, such as hair color, eye color, and height, but they didn't understand how this happened. In 1953, Francis Crick and James Watson discovered the double helical structure of the DNA molecule. This sparked an interest in the scientists to go further in depth of what the chromosome holds. Many years later, the Dr. Frederick Sanger created a technique to sequence the human genome. This gave the government the idea to fund a group of scientists who would sequence the human genome. The government gave the Human Genome Project 15 years to sequence the whole human genome. This seemed like a small window because, quote, it took 10 years just to figure out the one mistake that caused cystic fibrosis, end quote. Before the Human Genome Project, people didn't understand that children could inherit their parents' their genetic disorder. And they didn't understand that they had a genetic disorder until they started showing signs of it. There are 20 institutes around the world that contributed to sequencing the human genome. These institutes are located in Japan, France, Germany, China, the United States, and the United Kingdom. Without these institutes contributing to their assistance in the Human Genome Project, we would not have the whole human genome sequenced today. To contribute to this milestone in science, I think that insurance companies should cover the expenses of genome sequencing because it will improve personalized medicine, it will create more diagnosis of genetic diseases and disorders, and it will create a healthier lifestyle for more individuals. The first point that I bring up is that insurance companies should cover genome sequencing because it will improve personalized medicine. Personalized medicine is defined as, quote, a form of medicine that uses a person's genes, proteins, and environment to diagnose, prevent, and treat disease, end quote. Having personalized medicine be available for more individuals will help create a specialized treatment for more people. The most common form of personalized medicine is used among people who have cancer. Because we have seen people use personalized medicine in cancer, we have seen an improvement of people surviving cancer. Moreover, doctors that receive their patient's genome that is sequenced will be able to create a treatment that is specifically made to fit their genes. Quote, the type of cancer a person has and how it gets treated will no longer just be about where in the body the cancer started, such as the breast, lungs, and colon. More so now than ever, when doctors arm themselves with a wealth of knowledge and decide how to attack the cancer, they are arming themselves with a wealth of knowledge of the patient's genetic and molecular makeup of the tumor, end quote. Personalized cancer treatments work by giving the patient a personalized treatment. What the treatment does is target the cancer's genes and proteins, telling it to stop multiplying. Researchers are, quote, finding new targets each year and creating and testing new drugs for these targets, end quote. Our genes are very complex and hold a lot of secrets that our scientists have not yet discovered but need to crack. Luckily, geneticists have many years ahead of them to fine-tune personalized medicine and create treatment for genetic disorders such as Alzheimer's disease, Parkinson's disease, and Huntington's disease, and many others. Having insurance companies cover the cost of genome sequencing will also improve the death rate due to evidence-based medicine. Evidence-based medicine is different from personalized medicine because personalized medicine uses genome sequencing to create a specialized treatment for the person. But evidence-based medicine does not do that. Having insurance companies cover the cost of genome sequencing will also help improve the rate of preventable medical errors. Preventable medical errors, according to Aaron McCann, are due to doctors prescribing the wrong medication or patients reacting negatively to the medication. Quote, preventable medical errors persist as the number 3 killer in the US, third only to heart disease and cancer, claiming the lives of some 400,000 individuals each year, end quote. As you can see, having insurance companies know what you're at risk for can change the mortality rate among evidence-based medicine and preventable medical errors. Nathan Bourrion, a writer for Health IT Analytics, claims that, quote, between 1999 and 2014, pediatric cancer death rates dropped by 20%, suggesting that precision medicine has led to treatment advances, end quote. One idea that people against having insurance companies cover genome sequencing is that they're afraid the financial burden it could bring upon one individual. People who have insurance will be able to have that company pay for part of the prescription and genome sequencing, making it more affordable for them. But for those that do not have insurance, will have to pay out of pocket of the medical bills, the prescriptions, and doctor visits. An example of a prescription drug that is made to target the genes is called Kalydeco. Doctors have discovered that cystic fibrosis is not one mutation, but multiple mutations in a gene that affects more than one organ in the body. Recently, Boston Vertex Pharmaceuticals has created a drug that targets the genes in that have cystic fibrosis. Quote, Kalydeco is approved by the Food and Drug Administration for use of about 2,000 of the 30,000 cystic fibrosis patients. The cost, more than $300,000 yearly, end quote. To take in perspective of this amount of money, I would like you to consider a one-bedroom apartment that averages $800 a month. Now, instead of paying $800 a month, you pay that much money every day for 1 year. As you can see, a small amount of people use Kalydeco. This is probably because they either do not react towards it or they react negatively to it. It's also very expensive because it's made differently than non-personalized medicine. As Mangan writes, quote, personalized medicine is made from biologic materials as opposed to synthesized chemicals, and as a result, it is more expensive to develop initially, end quote. Biologic materials are made up of sugars, proteins, nucleic acids, and even cells and tissues. They're also not easily identified or characterized. A big problem with having insurance companies cover the cost of genome sequencing is that it will cost the insurance companies a lot of money to pay for that genome sequencing and personalized medicine. It will also result in blockbusters losing money because they mass produce evidence-based medicine. Blockbusters are large organizations that mass produce medicine that does not treat an illness specifically like personalized medicine, but rather generally like evidence-based medicine. It will also result in pharmaceutical companies to go bankrupt because they receive most of their profits from blockbusters. The technology and equipment that pharmaceutical companies will use to produce personalized medicine will limit the production of other common use drugs. This is an idea that Jita Anand brings up in her article, Big Drug Companies Tried to Delay Personalized Medicine Regimens. Quote, the technology for such genetic testing is now in use at some pharmaceutical and biotech companies. It can limit the production of some blockbuster products, end quote. As you can see, having insurance companies cover the costs of genome sequencing and personalized medicine will not only affect the insurance companies negatively as well, but it will also cause the blockbusters and pharmaceutical companies negatively. My second point is that genome sequencing will help improve the lives of many countless numbers of people. Having your genome sequenced will not make you a healthier person right away, but it will allow doctors to know what you are at risk for and can tell you how to change your diet, to exercise more, and take medications that can prevent the disease from popping up earlier. Rob Stein is an award-winning science journalist who has written about many people's reactions of having their genome sequenced. Snyder is one of those people that Stein writes about. Snyder found out that he was at risk of having type 2 diabetes, and so he had his friend who is a specialist in diabetes monitor his blood sugar levels. Within a couple months, Snyder found out that his blood sugar levels spiked, and he acted immediately on it. Quote, he completely changed his diet and kicked up his exercise. Within a couple months, his blood sugar levels fell back to normal, end quote. Snyder is a good example of why genome sequencing can help a lot of people. They will know what they're at risk for so that they could live a healthier and longer life. Knowing what you're at risk for will not only affect yourself, but it will affect the others around you. Knowing that, I believe that everyone has learned that each parent passes down half of their genetic material to their children. Knowing this, if you have a predisposition of having a genetic disorder, you have the possibility of passing that genetic disorder onto your children. For example, if you know that you are predisposed of having lung cancer, you can make sure that you do not smoke around your kids. Quote, armed with such genomic knowledge, mothers and fathers can make sure that they do not smoke around their children and later explain to them why it's a bad idea for them to take up a tobacco habit, end quote. People are afraid of discrimination becoming more predominant in our society with having insurance companies cover genome sequencing. J.A. Loudon is a journalist who has written about insurance companies discriminating among their clients. Quote, discrimination is what insurance companies do when they assess risk. There's a clear difference between a 70-year-old woman and an Olympic athlete, end quote. After the insurance company decides who they will take on as their client, they will decide how much that client has to pay them to receive coverage. How they do this is look at their individual risk. They take a large group of people of the same age and to see how healthy they are compared to the others. It will also make it harder for those that actually need insurance to be provided with insurance because insurance companies want people who are healthier because they're cheaper. People are also afraid of having that history will repeat itself. As seen throughout history, people discriminate among others based on their gender, their skin color, and their health. Hitler is a good example of someone committing genocide based on the traits that someone has had. He believed that people who had blonde hair and blue eyes, also known as the Aryan race, had superior traits than the others. Because of this belief, 6 million Jews were killed in the Holocaust, but they were not the only ones affected from this movement. The gypsies, the homosexuals, the mentally and physically disabled, and people who were against him were also killed. People are also afraid of having insurance companies know that what they're at risk for because, people are also afraid that immigration laws in America could be enacted again. Previously, there was an act in America called the McCarran-Walter Act of 1952. Quote, it focused upon denying immigrants who are unlawful, immoral, diseased in any way, politically radical, and etc., end quote. What the people were afraid of having immigrants coming into our nation was that if we were not exposed to a disease before, that it could create an epidemic within our society. Although disorders are different from diseases, disorders cannot be spread through exchanging bodily fluid or coughing on one another, but that disorder can become more predominant in our society due to reproduction. My last point that I bring up is that having insurance companies cover genome sequencing will allow more diagnosis of genetic disorders. Doing this will allow us to have more knowledge of genetic disorders and we'll be able to create treatments for them. Scientists have been studying ataxia in people who have a neurodegenerative disease. Studying the cellular pathways and protein networks, they have found that these pathways and networks are linked to our ataxias, which which is in our genes. Quote, this discovery has helped to better understand how aging plays a role in people who have a neurodegenerative disease, like ataxia. In addition, scientists compared ataxia to other neurodegenerative diseases and found a link between Alzheimer's, Parkinson's disease, and Huntington's disease, end quote. A law in New York has been passed that has been trying to better women's health care. What they're trying to do is to diagnose more women of breast cancer earlier. Quote, the law affecting group or blanket medical policies in New York continue the mandate for a baseline mammogram at age 35 and while covering annual breast exams beginning at age 40. The old mandate covered biannual exams beginning at age 40 to 49 and annual exams after that, end quote. What the New Yorkers are aiming for is to diagnose more women of breast cancer so that they have a better survival rate of cancer. The last problem I bring up is that people feel getting their genome sequence can create tension within a family and that people are not prepared to hear about a disease or disorder that could threaten their life. Families deciding to have their genome sequence should discuss their options prior to having it done. Some may not want to get their genome sequence because they feel it could tell them something that they did not want to know. Rena Vanzo, a writer for Hypertrophic Cardiomyopathy Association, says that, quote, two people may have very different opinions if genetic testing is a good idea, end quote. Receiving counseling before having your genome sequence is always a good idea because this will allow, quote, genetic counselors try to make them feel if they can handle bad news, end quote. If the counselors believe that you are not ready to know if you have a genetic disorder that will threaten their life, they should either deny you the right to have your genome sequenced or at least highly recommend for you to not have it done. People that are against having genome sequenced bring up that idea that people are not ready to hear about a disorder that will threaten their life and that it could create tension within a family. In conclusion, having insurance companies cover the cost of genome sequencing will help improve personalized medicine, it will help create a healthier lifestyle for more individuals, and it will help create more diagnosis of genetic diseases and disorders. Personalized medicine is significant for those that need specialized treatment for their genome. For mothers like Emil and Santiago, they will finally have answers to illnesses that could never be explained before. And for children like Nicholas Volker, will be able to live a normal childhood without undergoing countless hours of surgeries and pain. Genome sequencing is significant because it will create a healthier lifestyle for more individuals because they know what that risk for, and so they can change their life for the better. Having people get their genome sequence will also increase genetic diseases and disorders of diagnosing them. After all, if we have the technology to improve lives of countless number of individuals, don't we have the responsibility to care for those that were unlucky in the gene lottery?